I want to take you to Ottawa now, where the government is holding a briefing on Canada's vaccine rollout this morning. Let's listen.
We will each provide brief remarks and then open the floor to questions. And to assist us in answering your questions, we have with us Joël Paquette, Director General responsible for vaccine procurement from Public Services and Procurement Canada. To date, more than 3.4 million doses of COVID-19 vaccines have been administered in Canada. 6.8% of Canadians have received at least one dose, and 1.6% have received two doses. This includes 42% of people over 80 years old and 12% of those aged 70 to 79 who have received at least one dose. This is encouraging news. We are seeing vaccine administration continue to ramp up. In just the past week, provinces and territories have administered more than 672,000 doses of COVID-19 vaccines, which is the highest number administered in 1 week since vaccination began in mid-December. We have been pleased to hear from the provinces and territories at our Canadian Immunization Committee that the vaccine rollout has gained significant momentum in recent weeks as the rollout progresses and the number of doses available in Canada has increased. There's also a great deal of discussion about vaccines right now, such as their efficacy, effectiveness, supply, safety, and so on. As more and more people are vaccinated, we can expect that the data and recommendations on the use of vaccines will continue to evolve, which is the reason why, for example, the National Advisory Committee on Immunization, or NACI, based on real-world evidence, has just recently expanded its recommendation on the use of the AstraZeneca vaccine to include those 65 years of age and over. There are also recent headlines about potential adverse effects reported in Europe after some AstraZeneca vaccinations. Health Canada is working closely with international regulators to gather and assess the available information to determine whether there is a risk related to the vaccine and how best to address any risk that may be identified. Health Canada is participating right now in a meeting of the Safety Committee of the European Medicines Agency, and we expect there to be updates from those discussions available later today. The fact is that all 4 COVID-19 vaccines authorized by Health Canada meet our country's high standards for safety and provide a high degree of protection against severe illness and death related to COVID-19. 2 terms I mentioned earlier, efficacy and effectiveness, are sometimes used interchangeably when talking about vaccines. However, there is a difference between these 2 terms. Efficacy refers to how well a vaccine works under ideal and controlled circumstances. For example, vaccine efficacy is estimated during clinical trials by comparing outcomes between individuals who were administered the vaccine with those who were given a placebo. Effectiveness refers to how well a vaccine works under real-world conditions. The Public Health Agency of Canada, in cooperation with the Canadian Immunity Task Force, is funding various vaccine effectiveness studies to determine how well the approved vaccines are working in different settings. The Public Health Agency of Canada is also working with provinces and territories to monitor the impact of vaccine effectiveness on COVID-19 health outcomes, hospitalizations, and mild to severe disease in priority populations. It's true that no vaccine is 100% effective. But as they say in hockey, when it comes to scoring goals, you miss 100% of the shots you don't take. So take the COVID-19 vaccine that is offered to you. Thank you. Bonjour à toutes et à tous, et merci de vous joindre à nous pour la séance d'information technique d'aujourd'hui sur le déploiement des vaccins contre la COVID-19 au Canada. Je suis accompagné du Major Général Danny Fortin, vice-président des opérations et de la logistique à l'Agence de la santé publique du Canada. Nous ferons chacun des brefs commentaires, puis nous répondrons aux questions. Pour nous aider à répondre à vos questions, nous sommes accompagnés de Joël Paquette, directrice générale responsable de l'approvisionnement en vaccins des services publics et approvisionnement Canada. À ce jour,
To date, over 3.4 million doses of vaccines against COVID-19 have been administered across Canada. 6.8% of Canadians have received at least one dose, and 1.6% of Canadians have received 2 doses. That includes 42% of people over 80 and 12% of those between 70 and 79 who have received at least 1 dose. That's encouraging news. We have observed that vaccine administration continues to accelerate. Just last week, the provinces and territories administered over 672,000 COVID-19 vaccine doses, which represents the highest number of doses administered in 1 week since the beginning of the vaccination campaign in mid-December. We were happy to learn from provincial and territorial representatives on the Canadian Immunization Council that the vaccination campaign has intensified considerably in recent weeks. So that distribution is progressing and the number of doses available in Canada is increasing. There is also a great deal of discussion about vaccines at this time, for example, concerning their performance, their efficacy, their procurement, and their safety. As more and more people get vaccinated, the data and recommendations on vaccine use should continue to evolve, which explains, for example, why the National Advisory Committee on Immunization decided to change its recommendation concerning the its recommendation on the AstraZeneca vaccine to allow it to be administered to people 65 and over. There were also recent headlines concerning the possible side effects signaled in Europe following the use of the AstraZeneca vaccine. Health Canada is working in close collaboration with international regulatory bodies to collect and evaluate data to determine whether there is a risk associated with this vaccine and to determine the best way to attenuate risks that could be associated with it. Health Canada is currently participating in a meeting of the Safety Committee of the European Medicines Agency, and we are expecting to receive a summary of this meeting later today. The 4 vaccines against COVID-19 approved by Health Canada meet the rigorous safety standards of our country and offer a high degree of protection against serious illness and death tied to COVID-19. The 2 terms that I mentioned, efficacy and effectiveness, are sometimes used interchangeably when we talk about vaccines. There is, however, a difference between the 2. Efficacy designates how effective a vaccine is in controlled, ideal circumstances. For example, the efficacy of a vaccine is estimated during the clinical trials by comparing the results of those who've been vaccinated with those who received a placebo. The effectiveness designates how effective a vaccine is in real conditions. The Public Health Agency is working on, and it's funding a number of studies on the effectiveness of the vaccine to establish how effective different vaccines are in different conditions. The Public Health Agency of Canada is working with the provinces and the territories to oversee the effectiveness of vaccines against, in terms of hospitalizations, light to severe symptoms among the population. It is true that no vaccine is 100% effective, but as we say, if you miss 100% of the shots, you don't take. So please take the vaccine that you were offered. I would now invite Major General Denis Fortin to speak about vaccine logistics. Thank you.
Good morning, everyone. We have distributed over 4.7 million doses of vaccine so far, and numbers continue to increase rapidly. In total, by the end of March, Canada will have received 8 million vaccine doses from suppliers. The deliveries of Pfizer-BioNTech this week are completed. Next week, we're expecting our shipment to be 1.2 million doses. While it will be the first Pfizer-BioNTech shipment of this magnitude, we expect weekly deliveries to be approximately 1 million doses through the month of April through to the end of May. In total, by the end of March, we will have received 5.5 million doses of Pfizer-BioNTech, and we're on track to receive over 12 million doses between April and June. As for Moderna, we are expecting 846,000 doses next week, which will be divided into 2 shipments. One shipment will arrive midweek, one at the end of the week. This will complete Moderna's commitment for doses in Q1 of 2 million. As for shipments going into April, Moderna has confirmed our first shipment estimated at 855,000 doses for the week of April 5th, and our second shipment is approximately 1.2 million doses the week of April 19th. With regards to AstraZeneca, the provinces have on hand their allocation of the first 500,000 doses manufactured at the Serum Institute of India. Moving forward, we expect to receive over 1 million doses of vaccine in April and 500,000 still expected in May. We're working with the manufacturer to confirm the exact dates and delivery schedule. Now, discussions are still ongoing with Johnson & Johnson with the Janssen vaccine deliveries in Canada. We expect to receive 10 million doses before September. We will share information when we know more about the quantities to expect and the delivery schedule. As for the distribution process, FedEx and Omar have been providing a variety of services to support timely and efficient vaccine administration across the country. The logistics support will continue with both AstraZeneca and Johnson & Johnson COVID-19 vaccines. Overall, we're ramping up. Deliveries are increasing. Shipments of COVID-19 vaccines are expanding, allowing provinces and territories to increase their vaccination campaign. While more vaccines become available, provinces and territories assure us that they are ready for this increase. The important collaboration between federal, provincial, territorial, and Indigenous partners continues so that they can we can support them by providing them with the necessary ancillary equipment, the freezers, and other equipment to enhance their cold chain capacity as required. In conclusion, delivering safe and effective COVID-19 vaccine to Canadians as quickly and as efficiently as possible has always been the cornerstone of our operation. So we've been hard at work to put in place and implement a plan allowing us to deliver authorized vaccines to provinces and territories. So we're geared up to receive over 30 million vaccines in Q2. Thank you very much. Bonjour à
Good morning, everyone. We have distributed over 4.7 million doses of vaccine so far, and numbers continue to increase rapidly. In total, by the end of March, Canada will have received 8 million vaccine doses from suppliers. The deliveries of Pfizer-BioNTech doses this week are completed. Next week, we are expecting our shipment to be 1.2 million doses. While it will be the first Pfizer-BioNTech shipment of this magnitude, and then the following week will be the same thing, we expect weekly deliveries to be approximately 1 million doses in April and May. In total, by the end of March, we will have received 5.5 million doses of Pfizer-BioNTech, and we are on track to receive over 12 million doses between April and June. As for Moderna, we are expecting 846,000 doses next week, which will be divided into 2 shipments, one midweek and the other at the end of the week. One shipment. This will complete Moderna's shipment, a commitment for doses in Q1. As for shipments going into April, Moderna has confirmed our first shipment estimated at 855,000 doses for the week of April 5th, and our second shipment is approximately 1.2 doses in the week of April 19th. Concerning AstraZeneca, the provinces have on hand their allocation of the first 500,000 doses manufactured at the Serum Institute of India. Moving forward, we expect to receive over 1 million doses of this vaccine in April, and 500,000 are still expected in May. We are working with the manufacturer to confirm the exact dates and delivery schedule. Discussions are still ongoing with Johnson & Johnson for the Johnson vaccine deliveries in Canada. We expect to receive 10 million doses in the coming months. We will share information when we know more about the quantities to expect and the delivery schedule. As for the distribution process, FedEx Innomar has been providing a variety of services to support timely and efficient vaccine administration across the country. Their logistics support will continue with both AstraZeneca COVID-19 vaccines and Johnson & Johnson. Overall, we are ramping up. Deliveries are increasing and shipments of COVID-19 vaccine are expanding, allowing provinces and territories to increase their vaccination campaign. While more vaccines doses become available, the provinces and territories assure us that they are ready for this increase. The important collaboration between federal, provincial, territorial, and Indigenous partners continues so that we can support them by providing them with the necessary ancillary equipment and freezers to enhance their cold chain capacity as required. In conclusion, delivering safe and effective COVID-19 vaccines to Canadians as quickly and efficiently as possible has always been the cornerstone of our operation. We have worked hard to put in place and implement a plan allowing us to deliver authorized vaccines to the provinces and territories. We are gearing up to receive over 30 million doses of authorized COVID-19 vaccines in Q2 and a cumulative over 100 million doses in Q3. Thank you.
Thank you. We'll now open the lines for the question and answer portion of the briefing. As usual, we ask that you please limit yourselves to one question and one follow-up.
You may ask your question in the language of your choice. Operator, you have the floor.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Notre première question nous vient de Lina Dib de la presse canadienne. À vous la parole, please go ahead.
Oui, bonjour.
Question. Yes, good morning. Major General Fortin, my question is for you. I'm trying to do some math here. There are a lot of politicians who have made commitments recently, including Mr. Legault, who said that all Quebecers will have at least a first dose by June 24th. Can you tell us, with the numbers that you have in hand, what you plan to distribute in Quebec? Is that possible? Is it feasible? Can you give us the numbers that Quebec will receive by June 24th? Answer. Yes, well, I can focus on the Quebec numbers, just with the numbers that I cited. All signs are pointing to, well, if there is no disruption of vaccine delivery, and there's no indication that there will be, by the end of the next quarter, we will have received significant numbers of vaccines, which will allow the provinces to have in their possession enough vaccines to administer, to vaccinate all Canadians who wish a vaccine. I know from memory that we've been talking about 700,000 Pfizer vaccines in Quebec, and that increases significantly into the order of millions. It's roughly 270,000 vaccines. All this data is available on Health Canada's website for all Canadians to consult. Yes, question. But there's some vaccines for which you don't have any information. Johnson, you don't know. AstraZeneca, you don't know after the million, how long we will wait. You don't know when they will arrive. So I would like you to tell me specifically for Quebec, what guaranteed numbers do you have for Quebec by June 24th? Answer: no, I don't have guaranteed numbers for the end of June by jurisdiction. What I have are projections and contractual agreements. My colleague from Public Services and Procurement Canada can confirm other arrangements, but I can tell you that we are, during this quarter, we received 8 million. We will receive 12 million in the next quarter, and 12.3 from Moderna and Pfizer-BioNTech both. And then there are 500,000 from AstraZeneca from the Serum Institute. So those are, in terms of the exact calendar and delivery dates, I don't have that information. But Quebec is on track to receive sufficient quantities to meet the commitment made by the Premier of Quebec. Madame Paquette, you have anything to add? No, the Major General answered very well. Okay, thank you. Next question.
Thank you. Our next question is from Mia Robson from the Canadian Press. Please go ahead. À vous la parole.
Hi, Major General. My question sort of follows up on what Lena was asking. I'm just curious if, with the doses that we know are coming from Pfizer and Moderna, and the little bit of extra AstraZeneca we're getting, are those doses on their own enough to get one dose to every Canadian by the end of June, or do we still need other doses from AstraZeneca and Johnson & Johnson to hit that goal?
I think, so depending on every jurisdiction, they will apply the dose spacing, as my colleague, Dr. New, could get into, to different levels. But one way or another, the numbers I just laid out are for the current quarter and the next quarter. In total, Pfizer, BioNTech, and Moderna, between now or since the moment we started, to the end of the third quarter, we will have received 84 million doses of vaccine. And that is sufficient. I think just pure math is sufficient to vaccinate the vast majority of Canadians between now and September, and enough to provide a second dose. Now, how that applies and how that gets adjusted moving forward with additional vaccines, I'd be speculating. But on top of those 84 million plus the 500,000 to date with AstraZeneca, there will be more vaccines coming online and become available for Canadians and provinces and territories to administer.
Okay, but I'm pretty sure you just said in French that we would have enough vaccines to vaccinate all Canadians by June with the current numbers, with one dose.
It's Dr. New. Maybe I could add to what Major General Fortin has said. Certainly, if you look at the sort of the numbers of doses of vaccine that we anticipate coming to Canada, and you look at the Canadian population, and those who are eligible to obviously receive any of our authorized vaccines, it's exactly as indicated that it depends on the provinces as well, because certainly NACI has put forward recommendations. And the recommendations were based on real-world evidence with respect to extending the dosing interval, and that was also put in the context of a relative scarcity of vaccines. So it's still up to the provinces and territories to obviously take the NACI advice, obviously look at their own context, their own epidemiology, other factors, and determine how they would like to best administer the vaccine doses to their residents in their individual jurisdictions. I think by and large, I would say there is consensus among the chief medical officers of health from a public health perspective that it makes sense based on the available data we have to date that in terms of the greatest benefits at a population level, that they should go with giving all Canadians who are eligible, or offering at least to all Canadians who are eligible to get a vaccine, that one dose. And then after that one dose, obviously going back with that second dose for those who are obviously in the highest risk groups for severe illness and death. And so depending on sort of the rhythm and flow of vaccines coming to the country, there are a lot of moving parts, but hopefully we will be in a spot, in a few months, and where every Canadian will have received, if that's what each jurisdiction is moving forward with, that one dose, and then obviously also being able to offer that second dose for those vaccines in which there is obviously the two-dose regime. And it doesn't have to be 4 months. That was sort of up to 4 months based on the data available. But certainly, if a vaccine supply is more plentiful, and the provinces have already gone forward with their initial sort of administration of doses to those who are eligible and want to receive it, then certainly they could offer the vaccination in terms of the second dose to those who are eligible, and it doesn't have to be up to 4 months. That's sort of the outer limit, but certainly could be less than that. Thank you.
Mia, let me just add that my answer to the previous question with Canadian Press was with the assumption that we're discussing one dose, or the first dose, to Canadians. So that's where this timeline comes in with that answer to that first question.
Thank you. Merci. Prochaine question.
Thank you. La prochaine question nous vient de Raymond Filion de TVA. À vous la parole. Please go ahead.
Raymond Filion, TVA. Question. Thank you. Major General Fortin. Johnson & Johnson, AstraZeneca, and the 20 million doses that need to come to the United States. If I'm not mistaken, how is it that we still don't have any news? Should we be worried about that? Answer. Our colleagues at Public Services and Procurement Canada are in close collaboration with our government partners, in close discussions with the American government and manufacturers. My colleague could answer more on that, but currently we are working with concrete data. We are working with confirmed quantities and confirmed delivery schedules, and when we have the numbers from Johnson & Johnson, and same thing for others, and AstraZeneca doses, we will insert them into our distribution portfolio. Good morning, it's Joël Paquet. Thank you for the question. We are still in discussions with Johnson & Johnson and AstraZeneca on the delivery calendar, and we have no concerns about their ability to deliver doses. It's just a matter of determining when we will receive the first doses and the delivery schedule from that point on. Thank you. Thank you. Follow-up. We hear the Americans in the White House say that doses produced in the United States must first and foremost serve Americans. So since you don't know the numbers or the delivery schedule for the United States, and will that remain the case as long as there are still Americans to be vaccinated? Answer. Thank you for the question. Our discussions with AstraZeneca and Johnson & Johnson, we should receive a delivery schedule shortly, particularly for AstraZeneca, and with Johnson & Johnson in a few weeks as well. We will have received a delivery schedule. Thank you.
Merci. Thank you. Next question.
Thank you. Merci. Our next question is from Ryan Timothy from the National Post. Please go ahead. À vous la parole.
Yeah, good morning. I wonder about the Moderna doses that you just listed. That's about 2 million doses, just over 2 million doses in April. They're contracted to provide 12 million doses in the second quarter. I'm wondering if you're concerned that this could mean that the doses from Moderna are coming late, that they'll be backloaded towards the end of the quarter. Have you gotten any indication from the company about that?
I think from my perspective, they've delivered, or they're on track to deliver what they intended to deliver for this quarter, 2 million. They indicated all along that they're increasing their capacity significantly. We're seeing that with the numbers, the projections for April. They're now delivering on a 2-week cycle. As they get more predictability, more, regularity in their production, not to speak on their behalf, but we'll see those numbers increase significantly. So they continue to assure us that they will meet the objective of 12.3 million by the end of the quarter. That doesn't necessarily mean divided equally between the months, but the numbers so far, I have no concern with their ability to scale up and project those numbers. Certainly those who know about production of vaccines would back me up here to say that that's entirely predictable to have a rapid growth in production once you've stabilized your production.
Follow-up?
And just as a follow-up, maybe for Dr. New, we're going to get at least 7 million doses next month. What do you expect that to do to the pace and the scale of the pandemic? Do you expect to see, now that we're moving into significant numbers of Canadians being vaccinated, do you expect to see a real dent in the pandemic after this next month?
Thank you very much for the question. What I would say is that there are very encouraging signs with respect to some of the indicators that we're tracking. I think what we're looking for, obviously, is not necessarily sort of the number of cases. Of course, that's obviously of great interest. But as we know, the vaccines are really meant to prevent serious illness and death. And so we're tracking what we in the past have been calling lagging indicators, like hospitalizations, number of people in ICU, and obviously number of deaths. And we're starting to see encouraging signs from the data we are getting from the provinces and territories that they're starting to level off and plateau. And so that's a good sign. And we certainly anticipate that with vaccination increasing, that these indicators and the data we will receive will confirm and hopefully continue in the right direction.
Thank you. Merci. Next question.
Thank you. Our next question is from Charlie Pinkerton from iPolitics. Please go ahead. À vous la parole.
Hi there. My questions are for Major General Dan Fortin. We know our government has worked with the Biden administration to try and free up millions of doses of AstraZeneca's vaccine that are basically sitting idle in U.S. facilities right now. Would you be able to share what your planning for these vaccines looks like on the rollout front with this possibility in mind? I'm wondering if there's contingency planning going on to get these vaccines out as soon as possible, or if you're ignoring the possibility until it's confirmed that we've received them. Really, any information that you can give about the preparation for these to arrive would be very helpful.
Well, thank you. That was difficult to understand. I'm not sure I'm best positioned to answer this question, so I'll turn to my colleague from PSPC.
Hi, thanks for the question. Right now, we're maintaining discussions with the ongoing, and an update will be provided when available. Thank you.
Thank you. And for your follow-up, Charlie, we had problems hearing you. So if you could either speak slowly or use your phone rather than a hands-free device. Go ahead.
Sorry, does this sound any better?
Yes.
Okay, great. My question was more related to on the rollout front with this information in mind that our government is trying to get these vaccines. Is there planning happening about how quickly to distribute them, or is that being ignored until there's confirmation that we're receiving them or not?
Okay, thank you. I think I can answer that. Over the last several weeks, we've worked closely with provinces and territories to scale up to increase their capacity with the support that we can provide federally. Provinces and territories have participated in a rehearsal last week, more of an opportunity with over 170 participants to share some of the best practices, and there were themes that were discussed and follow-on discussions that are currently happening on a bilateral level with some of my team members and colleagues here from the agency, as well as the provinces, either separately or as a group. So this will pretty much be concluded this week. We'll have other rounds in the future. The aim of those rounds of discussion is to ensure that we have a sharing of best practices, that the good ideas are discussed. As we continue to mature our plans across the country, there are, while we have different variables to contend with, a lot of lessons are transferable from one jurisdiction to another. We've issued planning models or projection forecasts to provinces and territories. And the provinces, even more than territories, have a significant amount of people to vaccinate in the coming months, with scenarios where you have Pfizer-BioNTech and Moderna, and then layers of additional vaccines. So the low to high projection in terms of volume over time, and this will continue to adjust. We have an ability to adjust that in our models, and provinces will be able to see what is expected in the future and what they should have lined up in terms of resources to include clinics, the health workforce required over time. Provinces have assured us that they have solid plans to scale up using super vaccination sites, mobile clinics, leveraging some of the private sector capacity, leveraging their own contracts and distribution hub and spoke system inside their jurisdiction, as well as leveraging to maximum extent the federally contracted logistics service provider. And if required, federally, we can also assist with reprioritizing, shifting, or providing additional resources in terms of cold chain equipment, freezers, dry ice, and what have you. So it's a complex set of factors that is continuously looked at with all stakeholders. Our teams and the teams in provinces and territories are in constant discussion, and we make the necessary adjustments as we go.
Thank you. Merci. Prochaine question.
Thank you. Our next question is from Mackenzie Gray from CTV News. Please go ahead. À vous la parole.
Hi, my first question is for Major General Fortin. I'm following up on what Gray asked in French. Has AstraZeneca given the government any information as to why we have not been able to get any of the vaccines that are already made, sitting in a warehouse in the U.S., into Canada?
Hi, this is Joelle Paquette. It's just right now we have very strong relationships with the United States. We're in discussions, and we will give an update once we have further information. Thank you.
Okay, but there's tens of millions of doses that have been manufactured. The U.S. has not approved it. They can't use those vaccines right now. Canadians are sitting at home wondering why we are not able to get any of the 20 million vaccines we've got. Is it AstraZeneca telling us they won't ship us those vaccines, or is it the U.S. government saying we're not going to let those vaccines leave the country?
As I said, we are working with AstraZeneca. We will be getting a delivery schedule in the next couple of weeks, and we will provide that information once we have that available. Thank you.
Thank you. Merci. Prochaine question.
Thank you. Notre prochaine question nous vient de Laurence Martin de Radio-Canada.
Next question is from Laurence Martin, Radio-Canada. You have the floor. Question. Yes. Hello. A question for Major General Fortin. What is your biggest challenge for vaccine delivery? Answer. I think our biggest challenge is ensuring that we maximize the opportunities to transfer lessons learned from one lesson to another. I think the provinces not out of not wishing to share information, but they're experimenting and creating different processes. Some provinces are perhaps more advanced than others because of a variety of factors concerning the use of super sites, super clinics. Others have started using pharmacies, perhaps, for different types of vaccines. Some are limited to the AstraZeneca vaccine for now. I think the key to success here is to transfer information as much as possible in our very busy schedules so that we can determine what's usable. I and my colleagues have participated in a number of roundtables. There's a lot of information about, and trying to capture what's useful for each of the jurisdictions continues, I believe, to be a challenge. And tailoring that to the realities of different jurisdictions. Some of the lessons are applicable in the territories, are also applicable to the provinces and vice versa. So we continue to find opportunities to maximize information exchange concretely. And one of the efforts, one of the means of doing so, is to bring everyone together on a video conference and to try to have bilateral discussions where we can dig deeper into different practices, whether it's the provinces with us or us with the provinces.
Justement, peut-être un suivi là-dessus pour
follow-up.
Si vous aviez des étoiles là, à mettre à certaines provinces.
If you have any stars to give out to any provinces, who would you give them to right now? Which provinces are the role models?
Tout le monde a des étoiles.
Answer, everyone has stars.
Sérieusement?
Seriously?
Je pense qu'on a des...
I think there are useful comparisons to be made in some fields to share lessons. Some of them are more advanced than others because of their demographic realities and their territory. Some of them have vaccines that are more easily usable. They have smaller surface area. It's really hard to compare the provinces. We're continuing to ensure that we are on track for a massive increase in vaccination in the coming weeks, and we'll continue to work very closely with the provinces and territories.
Thank you. Next question.
Thank you. Our next question is from Tunda Charles from Toronto Star. Please go ahead. À vous la parole.
Hi, Major General Fortin. Despite your diplomatic answer there, we've seen big snags in provincial government's attempts to roll out appointment systems and whatnot. BC had trouble in the beginning with theirs. Ontario's had some big trouble with theirs. You keep saying that the provinces have assured you they're able to handle the massive volumes about to descend on them, and that the feds are ready to offer any support. So I'd like to know what kind of support beyond moving freezers around to facilitate storage and transport of vaccine have you offered? For example, has the federal government offered to take over or help with the phone bookings, for example, for provinces where there are issues about reaching elderly people in the community who don't have online booking of opportunities, aren't used to using the internet, what have you? Have you offered phone resources? Have you offered any other potential resources, volunteers to help provinces coordinate that? And if you have, what provinces, if any, have taken you up on it?
Yeah, thank you for the question. It's a very good question. Of course, we do more than redistribute and distribute freezers. That would be selling ourselves short here. But that's part of it. Establishing the cold chain, a robust cold chain, a cold supply chain, I guess is the word, over the last months was really key to the success moving forward. That includes contracts, that includes providing the equipment. And I think we are well on the way to having provided all the freezers and equipment that is required. We continue to work with our colleagues at PSPC on procuring ancillary supplies. There are 253 million items deployed by the agency to provinces and territories the whole range of ancillary supplies for vaccination campaign, mass vaccination campaign, and we'll continue to increase that. What we also do is, as part of our discussions in the various tables of discussion, is to offer assistance and for example, we have built over the months a national volunteer roster. My colleagues here have shared that with provinces. There's also more skilled workforce, health workforce that is identified, that raise their hands locally, that are also being directed, if we know about it, directed to the right source, the provinces and the territories. They are responsible for the immunization plans. So they're very much in the driver's seat. They tell us what they require. And we're not just passive here. We have groups of discussions with private sector that have excellent initiatives, and that also are either in discussion with provinces, and provinces are establishing that in their space, but also sharing that with other provinces is key. At our disposal federally, the tools are somewhat limited. But should there be a requirement to do what you described, for instance, we would begin a conversation with the province if they identify a specific requirement, either throughout the jurisdiction for a specific task or for a specific location. Then we could see what could be done federally. But provinces, while there are some glitches here and there with regards to system, as you've indicated, booking system, and other such areas, they continue to assure us that they're well on track. I would also highlight that we're rolling out new versions of SMS, or the management system, and there's interest with the provinces in seeing what it can do for them in terms of more integrated and I guess advanced system to administer the integrated supply chain, and we'll continue to do so and provide those tools to provinces and territories.
Thank you. Follow up.
Thanks. Yes. Thanks. I have a couple of. They're not. We were heard at a health committee. I think it was earlier this week. Might have been last week. I can't remember. But that the only province that has an adult vaccine registry is PEI, and I'm curious to know a few things. Is that in fact accurate as far as you understand? Perhaps Dr. New or General Fortin would know. Is that the only province that has an adult vaccine registry? Has there been any thought given to a national vaccine registry, as this came up as a desirable tool at this committee? And if you could also just break out, you said 100 million doses by September. Can you break down what you expect in terms of the AstraZeneca and J&J in that figure? You said 100 million. I actually find your figures on the website don't quite add up.
It's Dr. New. Maybe I can start on the issue or topic you mentioned about vaccine registries. I don't have the details of what you're referring to. Might have been discussed at the health committee, but certainly the understanding we have is that because healthcare delivery is a responsibility within the individual provinces and territories, they all have, I think, well-established what we call vaccine registries to track, in terms of having given doses of a whole range of vaccines to the residents of their individual provinces and territories. And so I think that's not really an issue. I think the point you're making about the interconnectedness between the various vaccine registries that exist right now in the individual provinces and territories, yes, that certainly is something that we're working on. From a federal perspective, we are offering sort of supports that we've been talking about, IT platforms and so on, so that there is more, I think, functionality in terms of being able to, let's say, exchange or collect information between the individual vaccine registries within the individual provinces and territories. And that's something that I think is one of those continuous improvement type initiatives that we're continuing to work on with our counterparts in the provinces and territories. So I think I'll leave it at that. Thank you.
Thank you. Next question.
Thank you. Our next question is from...
Sorry, there was another question there. and I'm just going to confirm for the 100 million. So you have the 84 million, which was the Pfizer and Moderna. Add 10 million of the J&J, of the Johnson & Johnson by end of September. 20 million of the AstraZeneca through our bilateral agreement by the end of September. And you're getting over 100 million doses before the end of September.
Thanks very much.
Okay, thank you for that point. So again, next question, please.
Thank you. Our next question is from Tom Perry from CBC News. Please go ahead.
Hi, thanks for taking my questions. I just wanted to return to a question that came up a little bit earlier. I'm just trying to figure out what the holdup is in getting a delivery schedule for the bulk of those AstraZeneca doses. When are we going to know when these doses are going to be arriving?
Thank you for the question. We should be getting this information in the coming weeks. Thank you.
And for Dr. New, I wonder if you could... I'm just wondering that with Ontario either in or on the cusp of a third wave, I'm wondering if you think there's any merit in the idea of, I guess, going into hotspots, really flooding the zone in areas like, say, the Golden Horseshoe or something like that to just try and nip this third wave in the bud. Do you think that there's any sense to a strategy like that?
Thank you very much for the question. What I would say in sort of a response to that question is that, yes, vaccines are an important tool. We certainly have seen how effective they have been in terms of providing a level of protection to those who are vaccinated. But as I would say, as I've repeated before, they're not the only tool. The public health measures that have been put in place, and also the individual practices that individuals should continue to obviously undertake, such as wearing a face mask, the hand hygiene. I keep repeating myself. Those are very important, and so it's not just a matter of the vaccination per se. With respect to how vaccines are used in a particular situation, as you mentioned, with outbreaks and hotspots, certainly I think the province has a better line of sight in terms of the context, the local epidemiology, and how they may want to use their vaccines in a given context. So I would leave it at that. But I would say that it's not just the vaccines alone that are going to be able to deal with the situation. If there is a potential for a third wave, and there's a lot of discussion, as I mentioned before, sometimes you don't know what a third wave, if a third wave is happening until sort of after the fact, or unless you've seen several weeks of, increasing cases. And even then there's I think some debate in terms of the definition of what might constitute a third wave. Right now it might be considered a bit of a wavelet or maybe a little blip. And if all goes well, maybe it'll just, the case count will go back down. Or if we see in the coming weeks, which obviously will be a consequence of the actions that Ontarians take right now, we might see, unfortunately, maybe the cases continuing to rise. So then we might then have a further discussion about whether we are in a third wave in Ontario. So I think short answer is that, yes, vaccines are an important tool, but they're not the only tool in terms of dealing with the specific hotspots and outbreaks. And public health measures, let's say for certain areas being in the red zone, and what local authorities may need to implement, in addition to obviously re-emphasizing the importance of personal protective measures, I think will continue to be important in addition to vaccines. Thank you.
Thank you. Merci. Prochaine question.
Thank you. Our next question is from Alison Martel from Reuters. Please go ahead. À vous la parole.
Thank you. Should we expect Pfizer deliveries to continue around that 1 million per week mark through May, or rise or fall from that level?
Yes, thank you for the question. Pfizer has assured us of deliveries of 1 million, approximately 1 million a week, every week of April, every week of May.
Okay, thank you. What about Moderna, that high point of 1.2 million in early May? Do you expect that to continue through the rest of the month, every 2 weeks? I guess once more that month it would be.
Yeah, Moderna has assured us that they can now deliver on a 2-week basis. We have 855,000 the week of 5 April, and the week of 19 April, around 1.2 million. And that's as far as we have for now. and we continue to have regular discussions with Moderna, and the manufacturer will confirm what we can expect to have in May reasonably soon. I think they, as I specified earlier, they continue to assure us that they're well on track to provide the quantities that they've identified for the quarter. So we have no reasons to doubt this at this time.
Okay, thank you.
Thank you. We have time for one last question and follow-up. Opérateur, à vous la parole.
Thank you. Merci. Our last question is from Cormac McSweeney from City News. Please go ahead. À vous la parole.
Yeah, you still have the end of September as your target for the goal of having every Canadian that wants a vaccine to get both doses. But getting 100 million doses in Q3 alone is more than enough to give every Canadian 2 doses. So why haven't we updated our target yet? When do you expect as well to give us an updated projection of when we will have enough vaccines to vaccinate every Canadian that wants one?
Let me start the answer, and I'll ask my colleague from PSPC if she has anything to add. But what Ms. Paquette laid out was total amounts in up to Q3 of 40 million plus 20 plus 10. In addition, other vaccines, as they become available and numbers solidify, will be added to the mix. So numbers alone would suggest that if administered as rapidly as possible, as effectively as possible throughout the country, we'll meet the target of vaccinating or offering the vaccines to as many Canadians as possible in a summer time frame or by fall. And I think I would want to stay prudent with that time frame. I think all our colleagues, my colleagues here, would want to stay prudent in that time frame. I would remind you that while there's no indications of disruption or fluctuations in the production, it is a global, it's a pandemic with global global demand on vaccines that are produced as rapidly as possible, and we're always subject to fluctuations in the production and the challenges of a complicated supply chain across the world and in this country. Now, I want to assure Canadians that we're well on track. Everything is solid. Manufacturers that we deal with all the time, Pfizer-BioNTech and Moderna, have assured us that they're on track to deliver. And I think they've proven that so far by quarter. Certainly, they're well on track to provide the total of 8 million doses. So I think I would leave it at that at this point. Thank you.
And as a follow-up, Dr. New, I just hoping for some clarification. You said in your opening comments about the AstraZeneca discussions happening out of Europe that you do expect updates to come out of that. Do you just mean general updates as in the findings of the European regulators, or do you expect any updates at all in federal guidelines on the AstraZeneca shot itself?
Okay, so thank you very much for the question. So what I would say is that our Health Canada colleagues, our regulator here in Canada, are actually participating. They're actually listening in or following the discussions at the meeting that I prefaced in my opening remarks. And if there are outcomes out of that meeting that have implications for, I guess, the vaccine vis-a-vis the approved vaccine, process here in Canada, then our Health Canada colleagues, I think, would make any necessary adjustments based on sort of their regulatory risk assessment process. At this point, certainly all of the 4 vaccines approved in Canada have been shown through the clinical trial data, and obviously even the data in the real world to date that they're safe and effective. I've said, and many others have said, that there's no evidence of any issue here in Canada. We have a very good surveillance system for what we call a post-marketing surveillance of adverse events following immunization here in Canada. There's been no signals to date coming to us at the federal level that there's any issue or unexpected safety signals. And so I think our Health Canada colleagues are, I think, with good sort of due diligence following what's happening in Europe, seeing what the data and the discussions are happening right now in the meeting. And then we'll make sort of any adjustments as appropriate and necessary for the Canadian context.
Thank you. Merci. This is the end of our technical briefing for today. Bonne journée à tous et à toutes.
All right, we have just been listening to the government hold a briefing on Canada's vaccine rollout. A couple headlines to bring you up to speed on. They were asked why the AstraZeneca vaccine is not being shipped from the United States to Canada. There are 20 million doses ready to go. They said that there was no update on that delivery schedule. They're waiting for it. Questions about a vaccine registry to track vaccines. Should there be one? A lot of people are calling for a federal registry. And we heard from Dr. New that he said that was up to the provinces because they deliver health care. And if you were wondering about the math, how we were going to get to 100 million doses of a vaccine by September, here is the breakdown. 84 million doses of Pfizer and Moderna, 10 million from Johnson & Johnson, and 20 million from AstraZeneca takes us over the 100 million mark by the fall.